Hello, my name is Angela Pack. I will be going over my interview that I did with Dr. Kenneth Wenzel. He is a Loma Linda director for clinical informatics. Um, During my interview, we kind of went over some background information on Mr. Wenzel, about how he was able to go to his position, what type of background information and experiences that he needed to be able to fulfill this position. Mr. Wenzel first had his degree in computer science, and then from his computer programming, he later on decided to go for his RN license while he worked at the ED in Loma Linda as the ED tech. Once he received his RN, he worked at the SICU at Loma Linda and also worked at Kaiser part-time. Due to his first degree in computer science, he was working for informatics teams at Kaiser for over 5 years. And due to his expertise and his computer science informatics, he became the lead for IT team and for Epic, which is the electronic health record. Due to Wenzel's qualifications in 2021, he was asked to work at Loma Linda as the clinical director of informatics. Mr. Wenzel's main focus was key resources in patient care regarding Epic's technology, which will allow for staff and patients to have resources at the tip of their fingers. One of his main streamlined clinical documentation was the main focus of Mr. Wenzel's implementation as the clinical informatics director. Using data from Epic, he will allow for progression in technology such as AI that can be implemented in patient care. It can also allow for proper budgeting to be used for excess money for resources that can be used at the hospital for other needs. Most tools are embedded for patient safety. Anything that can help make proper decisions for patients as a tool. This includes any type of administration, blood, medication, deterioration index, IV rate changes, double sign-offs, or on high risk medications, and allergy notifications, sepsis alerts, and change in lab values. The deterioration index is a key point that I have encountered at Loma Linda. Whenever there's a deteriorating index, it will populate as a notification when you're going into the patient's file, which will notify us to notify other team members such as the charge nurse, and as well as the physician, that the patient's status is deteriorating. This deteriorator index notification allows us for early implementation for change. CarePlan AI is a new implementation for technologies. Mr. Wenzel went over how AI can be implemented and voice recognition while we're in patients' rooms and while providing patient care of when we are going into the patient's room and explaining to the patient, "Hi, Mr. Smith. I will be going to do a quick assessment on you, and I'm going to hand out medications A, B, and C. And then I will also come in later and check back on you," and so on and so forth. By explaining this to the patient while we're in the patient's room, AI and voice recognition will be able to capture everything that we say to the patient, and then will be able to be implemented into the patient care notes. This way, nurses don't have to spend long periods of time having to go into patients' notations and writing every single thing that we did while we were in the patient's room. Instead, the AI will be able to upload all the information that we did with the patient while we were in the patient's room, which allows us for more time to be able to provide proper patient care or even let us have proper breaks. A lot of us are taking short breaks or because we aren't having enough time to be able to take care of the patients effectively while being able to take care of ourselves. So this is one way that we'll be able to give some healthcare providers a little extra time to be able to work more effectively. Loma Linda is considered a magnet hospital. Loma Linda is equipped with the following credentials and systems to be able to support the community as a magnet hospital. Mr. Wenzel works with the magnet team by looking at data and implementing goals and plans which can help with workflow of healthcare providers. There is a magnet team of 2 to 3 individuals from each floor of the hospital to help implement plans to achieve a goal to be successful magnet hospital. Individually part of the magnet team, but attend governance meetings to continuously implement processes so that Loma Linda can stand as a magnet hospital. The relationship between IT and clinical informatics teams work hand in hand to help produce the best outcome. Technology is so important when it comes to patient care and can be used as a big resource to provide a higher level of care. Artificial intelligence will be one of the highest driving points in advancement in technology to provide the safest and most effective care. Hopefully soon there will be voice recognition in patients' rooms so that while care is being provided and explained, AI will be able to collect the data from the care provided in the rooms and will generate a personalized care plan for the patient, as well as complete most of the charting. By providing more time for actual patient care and less on charting, patients can have more time for care. Many nurses are rushing cares due to the time management of having to care for 3 or 4 or 5 patients at a time. Allowing for ample amount of time for care from the time of charting will allow for a safe and more effective patient care. That is mostly what me and Mr. Wenzel went over in our interview. It was very interesting to know that AI will now be implemented more into technologies at the hospital so that not only is it helping the patients, but it's also helping us healthcare providers be able to provide effective and more forthcoming patient care. Thank you.